Let's have a wrap-up and a final overview on hospice Medicare admission criteria. Here's a quick overview. And to reiterate, everyone who is admitted to hospice has to have a terminal diagnosis and an evaluation of the specific criteria related to that diagnosis. We paint the picture to determine if the patient is ready for and meets the hospice admission criteria. The criteria are very complex, so at least familiarize yourself with the criteria and have a current document listing them close at hand for immediate review with you or in your computer as you begin that admission. Remember, once the patient is admitted and they continue to decline related to their terminal diagnosis, their life may extend beyond each certification period, and then the patient requires recertification for ongoing care by Medicare. Medicare requires that same exacting criteria to continue our hospice caregiving. As the patient's life continues, symptoms will change. The status of comorbidities may change and become more prevalent. In some cases, the terminal diagnosis actually needs to be changed. Be prepared for recertification by carefully documenting the patient's changes as they happen, the interventions you have made by hospice care, your medication titrations. Remember, admission and recertification is not always black and white. Be the detective, be observant, listen closely, even to what's not being said. Advocate for the patient in front of you. Gather information from current patient records. Again, family, friends, and caregivers as things go on. Always consider the use of the frailty scale as a tool to gather status specifics, and they help you make a case based on an objective numerical scale. Thanks for tuning into this playlist on hospice criteria. Visit our YouTube channel, the Hospice Care Plan, to learn how to manage all the major symptoms and how to provide ongoing, safe, and comfort care for your patient and family. Get our booklet for a crash course in hospice care at thehospicecareplan.com. Remember our motto, care is treatment.